everyone, I'm here with Doug Howard, and he is, are you the owner? Or the owner of Foothills. This is the character you're dealing with here. He's the owner of Foothills Rehabilitation Clinic. It's off of 75th Avenue in Deer Valley, and we're going to talk about dry needling today because I've been telling people about it for a while here, and there's a lot of questions and things that I don't really know the answer to, and I'm not really an expert, so I thought, why not come to the source? So Doug is going to answer some questions and needle me, and you're going to see that it does hurt, but it doesn't hurt like that much, and it's not something you should be scared of. And then I'm going to get up from the table, and I'm going to act like I feel a ton better, but it's not acting like I actually do feel a lot better. So let's
clean the skin off with a nice clean needle technique to limit the risk of infection. Anytime you break the skin of anything, there's always a risk of infection. That's the greatest risk with trigger point dry needling. Beyond that, there's not a whole lot. You might get a bruise, you might get a little bit sore. Basically, it is a myofascial release. Now, that's a big fancy word, but what I can tell you as another example of a myofascial release is a massage. Everybody's had a massage. It helps the muscular and fascial tissue move better, a little more readily. This is more effective than a massage or manual trigger point release or a deep tissue massage because it actually addresses the issue from within the muscle. So first, I will palpate and I'll find a generalized restriction or sometimes a very specific localized, what we call a trigger point in the muscle. And as you can tell by her reaction with her feet, Simone doesn't like it much when I touch that spot. Pretty bound up in there. So I'm going to place the needle atop the target, and Simone, you're going to feel a little tap. That was the tap. And then you're going to feel some pressure as I put this needle down into the muscle. Oftentimes we'll get a twitch in the muscle, which is a desired effect. Okay? That's a localized kind of electrical response. And now the needle's out, by the way, that we get as a result of putting the needle into the restricted tissue. Okay? That's actually a very desirable response, and that's when the muscle is actually loosening and the fiber is lengthening. All right, very tight upper trap. We're going to get a little stick and some pressure. And it's out. Okay?
I'm sweating.
That didn't take long. That's very normal to get an autonomic nervous response like that. It's a lot of folks. And now we're going to work down here into some of this rotator cuff musculature. We're going to start with the infraspinatus. I'm going to find a restriction, tap it, put the needle right into the muscle. Some good twitches in there. Stick, some pressure. Nice. Now we're going to move up to a deltoid. And find just right away, find a nice restricted area there. And some pressure. Big twitch in a big muscle like this. Probably see that on the camera also. That is actually that muscle fiber which had been bound up. After we see that twitch response, it is moving and gliding to its full length, which is important because each end of that muscle is attached to a bone. And if the muscle is dysfunctional, so too will be the bone or joint where it's attached. Okay, now we're going to come down here to Terry's group. Again, you've got some pretty good restriction in there. And it's out. How you doing? Still with me?
Yeah. So Doug, who should get this done? Like what kind? Like
there
what
are
kind of
so
conditions
few that cannot benefit from this. Any condition where there is some sort of myofascial or muscular involvement. We see 450 to 480 patient visits in this clinic every week. Not a single one of them doesn't have some sort of muscular issue.
Mm-hmm. So So a lot of times the people that I interact with and talk to about dry needling, they say, well, I'm not injured, I'm just tight, or I'm just sore, so I don't think I need it.
So would that person go get a massage?
Yes.
There you go. Is a more effective massage. Now, does it feel as good as a massage?
No.
But it's quicker and more effective.
It's a lot sweatier.
And it's probably less expensive. It's an upper trapezius, the most evil muscle on the human body.
Why?
Causes so much shoulder dysfunction. We talked a little bit about this at one point. 17 different muscles attached to your shoulder blade. But primarily because of our poor postures and the kind of forces that we constantly place on the upper trap, it tends to become overdeveloped. And it really kind of overpowers all the other muscles that are attached to the shoulder blade. And that ends up causing a lot of malpositioning of the blade. And leads to a whole lot of different types of shoulder pathology. Because this blade is meant to be in a very specific place, depending on where this humerus in the upper arm is located or moving at any one time.
So when you needling it, the goal is to get it to relax and to not be so tight and overpowering on the other?
Yes, exactly. To get it to be able to perform better, to move more fluently, to hurt less, certainly.
Oh my goodness. Oh,
How you holding up?
I'm doing great. I feel awesome. It's not true. I feel very sweaty.
You're putting up a little bit of a froth there.
Sorry.
It's a very normal response with this needling. Some people do a little pool.
No, Doug, that's just how I always am, though. Like, that's just common. Everywhere I go, I leave sweat everywhere. It's my curse. I feel like you just had like a big workout.
Let's ask her if nothing went south, let's start her active. If she did fine after the first go round, let's go actively. How you doing?
It feels better.
Yeah?
Yeah, it does. I'm not lying. And it feels better, and I feel a lot more muscular. Like I feel more like. And I know that you probably see that. You, as an expert right now, see that I look a lot like more buff and awesome. Right?
I could tell. Why would you say that? That's what I was thinking, but I didn't want to say because I didn't want to falsely inflate.